Okay, I think this is video number 5. Still talking about polyneuropathies, tetanus. Tetanus is an acute, often fatal disease caused by an exotoxin, also Clostridium related. This is Clostridium tetani, and it affects spinal and cranial nerves. It affects these nerves by blocking the inhibitory transmitters at the presynaptic sites in the spinal cord and the brainstem. Clostridium tetani also prefers low oxygen states, and it's an anaerobic bacillus. C. tetani will enter the body through a traumatic wound or a dental infection or a compound fracture or heroin injection. I have dental infections in there twice. It has an incubation period that is anywhere from 3 to 21 days, usually 7 days. It's not uncommon for symptoms of tetanus to appear after the wound is healed. Worldwide, there are 1 million cases a year, but in the U.S., there's only 50 to 70 cases a year. Look at that difference. It's really a worldwide problem. We've got it handled here in our country. In the U.S., there's a 10% mortality rate. The tetanus shot is good for 10 years unless you actually end up with an open wound. Then the recommendation is to get the booster if it's been less than 5 years. But otherwise, the tetanus immunization is good for 10 years. Manifestations. Trismus, which is tonic contraction of the muscles of mastication, and nuchal rigidity. That's where the term lockjaw comes from. Tetanus used to be associated with lockjaw. You get symptoms of infection, generalized tonic spasms, and these are pretty darn painful. A progressive rigidity. Opisthotonus is a rigidity and severe arching of the back with the head thrown backwards. I have some pictures of this, but it's kind of like if you lay a person on his or her back, only the back of the head and the heels would touch the supporting surface. If there are laryngeal spasms, that can lead to apnea and anoxia, and mortality is almost 100% in the severest form if this happens. You get overstimulation of the sympathetic nervous system, which can produce the symptoms that you see listed here. And again, I mentioned this is very painful. They have continuous tonic seizures. These are definitely third world pictures. This is that ophthalmatosis. You know, someone's holding the baby's foot and his head, and he's totally stiff. And here you see this total curvature. This poor little guy is clearly hurting. This is a picture of the lockjaw, the constant muscle contraction going on there. The collaborative care, administration of the tetanus toxoid booster every 10 years ensures protection, and generally for adults they get the TD, tetanus diphtheria combination. Before giving the tetanus toxoid booster and the tetanus immunoglobulin before the onset of symptoms will neutralize the circulating toxin. It does require a much larger dose for the patient with symptoms. You control spasms by deep sedation and paralyzing agent. A 10-day course of penicillin will further inhibit growth of the organization, and then mechanical ventilation. Tetanus cannot be transmitted from one person to another, and recovering from tetanus does not result in immunity. If an open wound occurs, now not a minor wound, not a clean wound, but if an open wound contaminated occurs and the patient's not been immunized within 5 years, the tetanus booster should be given. Supportive care will be based on clinical manifestations. Like I said, it doesn't happen in our country very often. That concludes our peripheral nerve problems. Enjoy. Shouldn't take you very long to work through this. Be sure to review the book on especially the nursing interventions, the particular nursing interventions for these processes, because I didn't go over those because the book does a absolutely fine job of it. Catch you next time.